Every year, millions of Americans have to slow down their lives for something that they can't even see and have no control over, contracting. Starting from 1932 up to 2012 currently, there has been 14 seasons where February has been the most positive testing month during the flu season. According to the CDC, influenza is a respiratory infection that is caused by a lot of different viruses. They're kind of just floating in the air. It's kind of a chance what you're going to get. Common cold is one, H1N1 is one, bird flu, stuff like that is all considered influenza. You all have the virus. It's just a matter of your body building up immunity to the different antigens. Some of the common symptoms of influenza include a cough, a fever, body aches, body chills, pretty much anything you can relate to a regular cold. In the emergency room, a lot of times we'll get a lot of the older population or a lot of the younger population, and it can develop into pneumonia a lot of the time, which is like a fluid buildup in your lungs. Or in little babies, we see it in croup, pertussis, stuff like that. It just leads up to bigger problems. Particularly in the emergency room, how we diagnose how it's happening is we can either do a rapid flu test, where we take this big long Q-tip and we shove it up your nostrils, fall around a little bit, and send it off to the lab. And then that way they can tell us exactly what antigens you have in your body and what's causing that flu, so that we can get you the right medicine. Or the way that I've seen it done now is we do what's called a blood culture, and we take about 20 milliliters of blood, and we have to really clean the area that we're going to poke you at with something called chloroprep, which is like a really strong antiseptic type thing, and we run for 2 minutes, and we poke you, draw our blood, and we have special vials we have to put it in, special precautions, stuff like that, so that we make sure that our specimens aren't contaminated. And that way is a lot better for us and for the lab, because we really figure out what's going on and kind of how far along it is and how we can treat it even better and get rid of it faster. Some of the treatments we use in the emergency room are, we like to use antiviral medications like a Z-Pak, which are mostly just pills you take for 10 days, and it rids your antigens faster and gets your body immune to them.
No.
I'll talk about it. Also, you can use the common thing you use for a cold, just rest and lots of fluids, and some over-the-counter cold medicines to kind of subside your symptoms. Also, we use flu vaccine. All the employees at the hospitals have to get flu vaccine, which just prevents it, along with good hand hygiene, stuff like that to prevent. But there's really nothing that's going to stop you from getting the flu. Everybody's going to get it, but it is something that is treatable, something that's easy to diagnose, but we're never going to fully eliminate that just because it's all the stuff we have floating in the air. There's no way that we're going to get around it. So, in conclusion, influenza is just something that we're going to have to live with, something we're going to have to focus our energy into, but it is something that we can treat and diagnose and the symptoms are pretty common. Thank you.
What's the, you say we're